Sure.
So, yeah, perfect. So, good evening, everyone. My name is Mohamed Hassan, and I'm a mentor for Part 2 MRCOG course by Mid-Exam Expert. Dr. Zaib,
Yes, I am Dr.
that's
Zaib
with me.
Qureshi. Yes, I am Dr. Zaib Qureshi. I am one of the mentors at Exam Expert for Part 2 course and the other courses as well. So hopefully you guys will see us frequently on your Facebook, on your Telegram, and I'm sure we will be with you till January exam. Okay?
Excellent. Yes,
So,
exactly.
yes.
And we are so much proud that we are conducting the course also with Dr. Pooja Sharma and with
Yes.
Dr. Bradnia. They are our colleagues in this course as mentors. This is the first course to be conducted by 4 mentors for Part 2 MRCOG. We thought that it's a powerful and strengthened point to support all our candidates for this exam preparation. This is maybe the first and the only course conducted by 4 mentors. All of you, my friends, you will gain the maximum benefit and the maximum experience of each mentor separately. Okay. Now, for me, it's very important point to conduct my experience towards all of you. But if you are taking the course exclusively with Mohamed Hassan, you will only gain the experience of Mohamed Hassan. But in this course, you will gain the 4 different experiences from different countries and different mentalities, and this will be so much beneficial to all of you in your preparation. So this is one of the most important, powerful points in mid-exam expert course for January 2022. I would like to give the introduction for this session, and proudly I will then turn over the mic to my dear colleague, Dr. Zaib. So let's start by few principles related to this session. Today we will discuss together the curriculum, how to prepare for Part 2 MRCOG, general strategies or recommendations for a good preparation, and finally, the technical team will discuss with all of you about the details of this course. Okay? So, next, please. Yes. The curriculum. Now, let's say something. The MRCOG Part 2 exam is considered one of the most difficult exams in our field of Ops and Gynae. Why? Now, take this. One of the most important difficult points, the curriculum. The curriculum is like an ocean. Too much sources, too much recommendations here and there, guidelines everywhere, articles, e-learning sites. So you should most probably cover these modules according to the RCOG recommendations to fulfill about 80% at least of the curriculum of the exam. These modules including the clinical skills and clinical governance, research, assessment as a paramedical points, then the post-operative care and surgical procedures, principles of surgical procedures should be also included, antenatal care, maternal medicine, special conditions, management of labor and delivery, and postpartum complications. In gynecology problems including the menopause, the PMS, the heavy menstrual bleeding, all of these topics, the endocrinology should be covered. Subfertility is a major topic. Sexual and reproductive health is mainly concerned about the family planning methods from the Faculty of Sexual and Reproductive Health, early pregnancy complication, gynae-onc, and urogynecology. 18 modules. You should be sure that you have the minimum limit of the standard of knowledge in these modules, all of these modules. Don't escape anyone. You should cover everything. Maybe you may cover one module 100%, but the other modules may be difficult, maybe you are not working, you're not practicing these modules. You should cover the standard informations related to these modules. In this way, you can cover most of important questions in exam. And this is our target. Our target not to cover everything to bring 100% in exam. My target is to meet the standards. And this is how can you meet the standards, okay? This is regarding the curriculum, which is recommended by the Royal College of Obstetricians and Gynecologists. What is next? Okay. The exam. All of you knows the type of questions starting from 2015. The exam is changed from the written MCQs and EMQs to be just SBAs, single best answers, and extended matched questions. Exam is divided into two papers. Previously, paper one was gynecology, paper two was obstetrics. Now the questions are mixed. So in paper one, you will meet 50 question single best answers, 50 question EMQs, mixed questions actually between gyne and ops, and the same in paper two. The single best answers equivalent to 40% of the total mark of the exam, while the EMQs equivalent to 60%. The college recommends 60 to 70 minutes for SBAs and 110, 120 minutes for EMQs. We will discuss these points later during our course, during the tips and tricks for real exam date. How can you manage your time table in the real exam? We will discuss it later through the course, but this is the recommendations of the college, which almost me, Dr. Zaib, we are against it, by the way. Okay. You agree with me or not, Dr. Zaib?
Yes, I do. I 100% agree with you in this thing that obviously, you know, we have to go that how to solve the paper because there are multiple schools of thoughts. So obviously, if it is like, I mean, the paper is set 50% in the initial, you know, the period, it's like, I mean, 50 questions, single best answers, and then there are extended match questions. Then people, you know, do recommend that, okay, attempt extended match questions first and then come to single best answers. Some says, okay, no, go with the flow, okay, and solve SBAs first and then comes to EMQ part. So obviously, you know, that is, you know, the different, and obviously everybody has different strategy. So moreover, when you will solve your questions and when you will do multiple mocks, so you will ultimately come to know that how you have to do the questions in your own way. Okay, so that is going to
Exactly.
be almost, you know, on up to you, up to your practice, and obviously, you know, the way you are comfortable with. So roughly, you know, if we are talking about that, okay, we have to solve single best answers in like 60 to 70 minutes, 50 questions in one paper. So roughly you have to give almost 1.5 minute, 1.5 minute to each question roughly. Okay, so this is how you can divide. So for example, one paper is of 3 hours and the other paper is also 3 hours, right? And in between you will have 1 hour gap. So what you can do is that this 3 hour, 1 hour you can spend it on single best answers, and the 2 hours you can spend on extended match questions. So this is because extended match questions needs time, needs, you know, to you to concentrate, needs to choose, and in every question you have to read all options from A to Z, whatever they are. So obviously, you know, you need time. So roughly, you know, this is a kind of a rough estimate. So yes, whatever, you know, the way you adapt and whichever way you think is suitable for you, you can go with that. So there is no hard and fast rule. Okay, so this is just rough estimate. So don't ever think that if we are telling you that this is the, you know, the recommended thing or something, but this is just a kind of rough estimate that how you will go in the exam. So obviously, whenever you will start your study on the basis of the curriculum, So obviously you will train yourself by doing so many exam questions that by the end of your preparation, you will be confident enough that at least you can go to exam in a confident manner, that you can do and solve questions in your own way. So yes, this is all about you. This is all about your preparation and your own way, because we all are doctors, we all are chosen one, and every one of us has a unique way to communicate, unique way to study, unique way to look at the question again. Okay, so yes, I do agree with Dr. Hassan that obviously there is no hard and fast rule, so this is just a rough estimate. Okay.
Exactly, exactly. Thank you,
Yes.
Dr. Zaid. So
Okay.
the major bulk where to study from, I will give the principles, and I will then give Dr. Zaid the mic to give you the depth of knowledge in this point, because she's so much experienced in the sources as well. So the major bulk, all of you knows that we should follow the Green Top guidelines as the highest evidence-based knowledge info in our exam. Then the NICE guidelines, considered as the second option. By the way, NICE guidelines most probably discussing different topics than the Green Dot guidelines. So there is almost no contradiction between the between the NICE guidelines and Green Top guidelines. However, we have multiple other sources to study from. TOG articles most probably last 3 to 5 years should be covered. Not all TOGs in the last 3 to 5 years. Selected topics are considered important, as well as we have selected topics of TOG articles earlier than 5 years, maybe 10 years
Earlier.
ago.
Yes.
Yeah, maybe 10 years, maybe 8 years ago, but they are considered very important, and there is no replacement source for these points or these topics. So you have to cover them, and this is what we will do together. Okay. The PASH guidelines for infections, the NHS recommendations and flowcharts for colposcopy and cervical screening program, the Faculty of Sexual and Reproductive Health guidelines for family planning, and consent advice guidelines, especially in incidences and related surgical complications. This is the main source. And good practice guidelines, we have very selected topics to be covered from there. And finally, we are summarizing together during our course the MPRACE report of UK last 2 years. According to the new updates, it's related to the maternal and neonatal mortalities over UK, and it's already updated every 2 years. So this is the major sources to revise and to study from. Okay. After that,
I want to add one thing over here, because where many candidates get confused that okay, do we have to cover all PASH guidelines? Dr. Hassan, I want your input in this, please.
yes, the PASH guidelines. Now let's say something. As in TOG guidelines or TOG articles, we have multiple of sources and multiple parties. The college are doing multiple parties. For example, in hematological diseases in pregnancy, RH guidelines or something, these guidelines are published by a cooperation party between the college and the hematology society, British hematological societies, and so on. So we have multiple sources. We are selecting the most important things related to our practice, and we are concentrating on these sources. This is applied on TOG, applied on PASH, applied on Faculty of Sexual and Reproductive Health guidelines, and in most of additional guidelines. What is important to be taken as it, all of it, the Green Top guidelines and the important related NICE guidelines to our practice. So this is our mission actually, Dr. Zaib, to select the most important things to the candidates, because many candidates are suffering a lot with these multiple sources. So why you are taking a course? why you are sticking to 1 or 2 or 3 mentors, because they will shorten your pathway to the target. And this is
Exactly.
actually our mission. Exactly. Okay. So next, please. Yes. Overview of GTGs. Dr. Zaib, would you like to take the mic from me?
Yes, yes, yes. Thank you.
Because
Thank you
I'm
so
too
much.
much talkative. So you have to stop me.
No, no, it's
You
okay.
have
It's
to stop
okay.
me. Thank you,
It's
Dr.
okay.
Zaib. Please take them.
Okay, okay. So regarding this, I will continue with this regarding faculty of sexual and reproductive health guidelines. We have got plenty of guidelines, right? So we have got almost 30 plus or 40 plus say guidelines. Okay. But all these guidelines are not designed for us as an MRCOG candidate. So what we have to do is that we have to choose the selective one. Okay. Because by the end, we are not going to be the diploma in FSRH. Okay, we just need to know what exactly the guidelines which we have to cover for our curriculum. Okay, for example, we have to know about the combined hormonal contraceptive guideline. We should understand the progesterone only contraception method. Then we should understand the intrauterine contraception. Then we have, the most important guidelines, the contraception in heart diseases, contraception around 40 years of the age. So almost, these kind of guidelines are very much important, which you have to cover. And if time allows, then yes, you can go through. But I am afraid that, even after doing this 60% bulk of this, the green top guideline and also the nice guidelines plus TOG articles, you will hardly have time to cover everything yourself. Okay, at first place. Secondly, obviously, when we are giving you sessions, so obviously we are going to give you the concise points, because Dr. Hassan will agree with me that before session we give almost 2 to 3 days to study ourselves, to update ourselves as well, because obviously we are going to present the session to you. So obviously we should understand and we should know that from where we will cover the curriculum. For example, if we have to cover one topic, so obviously we will try to find out, okay, what are the sources, which of the source we can get from, the multiple sources. The scientific impact papers are very few, and you don't have to do all scientific impact papers. Yes, there are scientific impact papers like vitamin D you have to do, like analgesia, anesthesia you have to do. But analgesia, anesthesia, you can cover it from TOG article as well. So they are almost same. Okay, so it's not necessary that for one source you are going to do the same, you are going to follow two sources for one topic. This is not recommended at all. Okay, so if you are choosing TOG article, so I have gone through TOG article, I have gone through scientific impact paper of analgesia, anesthesia and labor as well. So I didn't find any kind of big difference. Okay, so if you are doing TOG article, so that's more than enough. Okay, you don't have to worry about that you have to cover each and everything, then you are going to pass. No, always remember, you have to cover your bulk first. So if you cover your bulk first, that is going to make almost 60 to 70% of curriculum. Okay, then rest 30 to 40% of the curriculum will be covered by TOG articles along with batch guidelines, colposcopy guideline, FSRH guidelines. Okay, in terms of colposcopy guideline, then yes, you can have 2 or 3 SPAs, then you can have 1 or 2 EMQs as well. That's it. Okay, not more than that. So what you need to do is that you have to put your all efforts on the bulk. This is what we do, isn't it, in our real life as well, that we always prioritize, we always think that what we have to do and what we not have to do. All right, so this is how we are going to do. Yes, Dr. Hassan.
Yes, Dr. Zaib. I raised my hand before.
Yes, yes,
So
yes.
what I would like to say is we have two important points I would like to say to
Mhm.
all candidates. Number one, regarding the sources, sometimes you may suffer from a conflict in information between NICE guidelines or green top guidelines with TOG articles, for example. Okay. Now, many candidates asking me what source I should follow. Okay.
Mhm.
For example, in infertility, we have different informations between the TOG recommendations and the NICE guidelines recommendations. However, the NICE guidelines are older edition, while the TOG are recent edition. Okay? But I will follow the NICE guideline because I'm following the highest body of evidence. rather than following some few articles. You have to understand this very well. Green Top Guideline is the top, and then the nice guidelines, and finally the top articles and other guidance. Okay, so when you have any conflict between the sources, you have to follow the highest body, even its older edition than the newest edition of article or something, unless the guideline is archived. This is a very important point. For example, the Green Top Guideline of preterm labor. We have a Green Top Guideline of preterm labor and nice guideline of preterm labor. Which one I should follow? By my rule, I should follow the Green Top Guideline. But please notice that the Green Top Guideline is archived. So I should follow the nice guideline, okay? So this is a very important tips to be understood very well. Another thing is, as Dr. Zaib said, but literally, you should cover the bulk. You should cover the most common, because this is the only way to pass the exam. Don't try to waste your time and effort in miscellaneous topics, very sophisticated topics. Try to cover the majors, okay? Once you covered basics and major topics, you will pass spontaneously with the least effort and the least time consuming. What do you think, Dr. Zaib?
Exactly. So what I think is another important thing is that, because this is our practice these days, that we are following so many groups, we are following so many the guidelines from here and there. So that's why we get very much confused. So if we are getting
Yes.
confused, so obviously it's making our mind in a way that every time we will be thinking, okay, do we have to do this, do we have to cover this, do we have to cover this or not? So please, all of you guys, if you take our words, our wise words, in fact, because we both are in teaching, and we both are teaching for last, I don't know, many years. Okay, so obviously we do have a clear idea about exam and about curriculum as well, and obviously we are practicing OBG as well. So altogether we do have clinical knowledge, we do have theoretical knowledge as well. So yes, when we do teach, we do try to give you the examples as well regarding the curriculum, regarding our success stories from the previous candidates, and also our own story as well. Okay, because we have also struggled in this exam. Okay, so if we are mentor today, so obviously it's not like that we were born mentors, so we have worked hard for it. So obviously when we are giving you something, any piece of advice, so please take it seriously. Just think that we are giving you advice from 100% of us, and that is going to be a sincere and a very wise advice, because we have gone through a lot, we have faced a lot, and we have struggled a lot to be at this level, that at least we can guide, we can teach, and we can mentor. Okay, so another piece of advice is going to be, don't follow so many sources and don't follow so many advice. What do you think, Dr. Hassan?
Actually, this is a very critical point. I said before, the curriculum is like an ocean. So in the ocean, you will find too much boats here and there. So if you would like to pass the ocean successfully, you have to trust one large boat and follow it. If you waste your time running between the different groups and looking for too much possible questions to read and to answer and do blah, 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 reading much sources, you will find yourself before the real exam lost. Nobody can cover everything. You have to believe in that. Even the president of the college, he is not covering all information. He is not aware about the new update guidelines. Believe me, okay? Nobody can do that. Please don't tell the president of the college that I said that, okay? So, but this is the truth, okay? So you have to believe that nobody can cover everything. You should cover the most important thing. How can you do that? I can trust mentors. I can follow the instructions and condense my time and effort in 1-2 groups maximally. Don't open too much sources. I agree 100% with you, Dr. Zaib. Actually, very, very critical advice.
And another thing is, what I believe is that, if we are part of so many groups, so what we will do in the end, that we will end up in reading only messages. So when we will study for ourselves, if we are just reading the, the messages and all, okay, so it's because this is your exam, you have to utilize this time wisely, you have to do everything wisely, because in the end, these days everything is so difficult, getting seat is difficult, getting center is difficult. And then obviously, if you guys get the chance to go for the exam, just go with the full throttle, with full preparation, without any loopholes in your preparation. So yes, in a course we do try to give concise material to study, and obviously the advices as well. Regarding percentages, then yes, obviously 7 to 8 questions can come from the percentages section as well. So, I mean, nobody can tell you from where that will come. So this is your job as an exam candidate, that when you study, so try to write down all these percentages on your notebook, try to make your own notes, okay, in terms of important incidences, percentages, and then revise them always, okay. So if you revise them, then obviously it's going to be easy, because I'm sure because we all are doctors and we are almost very poor in numbers, okay. So yes, this is the only way where we can only retain all percentages, that after revising and revising and revising these percentages again and again, okay. Yes, 7 to 8 questions can come from percentages, so you have to be very prepared for this thing as well. Okay, so now I will talk about the Green Top guidelines. We have got plenty of guidelines, and these guidelines are straight away taken from, the sources are taken away from the website as well. So they have got, the guideline number 1, 2, 3, 4, 5. But if you can see that USI guidelines have been archived long ago. So if you see in old, the kind of collection here and there, don't follow it. Because for the incontinence, we just have to, follow NICE guideline. Severe preeclampsia, eclampsia, it has been archived, and now we are just following NICE guideline for hypertension and eclampsia as well. Early pregnancy loss management, no, we are not following this because it has been archived. So we do have ectopic pregnancy and miscarriage guideline now for the NICE guideline and ectopic pregnancy itself, the Green Top guideline. Endometriosis, NICE, this Green Top guideline has been archived, and now we are following NICE guideline for it, or we are following some points from the ISHRE guideline. That's it. Okay. I will talk about this ISHRE guideline as well when the time comes for the endometriosis. Laparoscopic injuries, yes, it has been transferred to British Society of Gynecological Endoscopy, BSGE. So if you guys download, and this is my recommendation to all of you, that please follow and try to download every guideline from the Royal College website and NICE guideline itself, okay, because everything is free to download. So this way, what you can do is that you are not going to miss anything, okay, because there are multiple PDF sources available here and there. So please don't follow them. Then we have got PID BASH guideline. So PID, it has been archived, and now we are following only BASH guidelines. Gestational trophoblastic disease, very important guideline, and it has been revised into 2020. So please don't follow old PDF stuff. Malaria and pregnancy diagnosis and treatment, very important. Malaria and pregnancy prevention, two important guidelines. Although it hasn't been revised, but yes, the recommendation are same. Amniocentesis and chorionic villus sampling. Although it is an old guideline, but it's a very beautiful guideline. Then VTE, very important, and hormonal contraception. It has been archived, and now we are following, for contraception, we are following the FSRH guideline. PPROM, yes, it's a new guideline that came in 2019, and it's a very important guideline. Antenatal steroids, it has been archived, and now we are just following NICE guideline, preterm labor and birth. Late IUFT stillbirth, maternal collapse, very important, operative vaginal delivery, and now the name has been changed lately, and it has been termed as assisted vaginal birth, AVB. Okay, so yes, you will definitely see many, the questions and many sources which are available in PDF format here and there. So you will see old guideline, but now it has been recently revised, assisted vaginal birth. Okay, you have to do this guideline. Vulval skin disorders, but we have to follow BASH guideline and NICE guideline for that. Preterm labor tocolytic drug, no, we don't have any preterm guideline, Green Top guideline. We do follow only NICE. Reduce fetal movement, yes. Breast cancer in pregnancy, the use of anti-D, it has been archived. And now we do follow BCSH guideline on anti-D in pregnancy. Best practice in outpatient hysteroscopy, we don't do follow it sometimes, okay, because for the hysteroscopy we do follow one TOG article only. Cervical cerclage, there is no guideline for cervical cerclage anymore. Recurrent miscarriage, yes, it's an important guideline. Obstetric cholestasis, VTE and HRT, it has been archived. Now we are following only FSRH. Management of sickle cell disease, very important guideline. Then suspected ovarian masses, premenopausal, postmenopausal, antepartum hemorrhage, and now you all know that we have got vasa previa as a different guideline as well, isn't it? Shoulder dystocia, bacterial sepsis in pregnancy, bacterial sepsis following pregnancy. So we have got two guidelines for sepsis as well. Plus for sepsis, we have another source. We have recent talk article of 2020. Okay, so you have to do that TOG article as well, because some of the drugs have been changed, okay, for the sepsis. Initial management of chronic pelvic pain, yes. Then small for gestational age fetus, very important and beautiful guideline. Management of beta thalassemia, red cell antibodies, long-term consequences of PCOD. So always remember, when you are covering this PCOD topic, PCOS, or you can say, then you have to follow one or two TOG article as well. Okay, so we have got two TOG articles. One is long-term consequences of PCOS. Then the other TOG article is type 1 ovulatory disorder. Okay, so mark my words, if you just try to do a topic, the PCOD, and then you follow these 2 or 3 talk related talk articles, so this way you can cover your one topic, and this way you are going to be in good shape to recall this topic as well. And this way you will also be happy that at least you have covered one topic as a whole topic. Umbilical cord prolapse, chickenpox in pregnancy, acute management of VTE, reducing the risk of VTE, BT in obstetrics, very important topic. Management of 3rd and 4th degree perineal tears, FGM and its management. Okay, for FGM and its management, we have got this, the green top guideline. Then we do have one TOG article as well for FGM. Okay, so major part of the FGM is going to be covered by this FGM green top guideline. So in some question, if you do see any kind of, the question which are basically formulated on TOG article, then yes, you can open that. But otherwise, don't follow two sources for one topic. Your priority should be green top guideline first, and if time allows, if you think that you cannot solve any of the question, then yes, go to the TOG article for same topic. Post hysterectomy, vaginal wart prolapse, birth after previous cesarean section, endometrial hypoplasia, OHSS, epilepsy, nausea, vomiting in pregnancy, ovarian cyst in pre-postmenopausal women, ectopic, MC, monochorionic twin pregnancy, premenstrual syndrome, bladder pain syndrome, PPH, then ECV, and reducing the incidence of term breach itself, then inherited bleeding disorders. Okay, for bleeding disorders, we have 3 sources, right? We have got, the thalassemia, we have got sickle cell disease, we have got inherited bleeding disorders in pregnancy. Okay, then we are left with only iron deficiency anemia. Okay, for iron deficiency anemia, we have got a very beautiful TOG article. So we have to cover for iron deficiency anemia from that TOG article. So this way you can cover your 4, the bleeding, or you can say the bleeding disorders, the hematological disorders, sorry. Early onset GBS, important one. Vasa previa, then placenta previa, placenta accreta. So vasa previa, placenta previa accreta plus APH. So this is going to be in one heading, obviously, okay? The antepartum hemorrhage. So be extremely careful when you do cover these 3 guidelines for the APH. Obesity in pregnancy, very important guideline, and this is not going to leave you in for your part 3 as well later on. For the NICE guidelines, so even though we can miss 1 or 2 guideline over here as well, but since these guidelines are taken from Royal College, so I believe that the 63 numbers are 63 guidelines are there. Then for the NICE guideline, we have got diabetes, we have got hypertension, infertility, urinary incontinence, mental health guideline, cesarean section, intrapartum care, menopause, postnatal care, surgical site infection, LARC, induction of labor, preterm labor. So if you just focus on NICE guideline, you will see that we have to cover the labor module from NICE guideline only. Okay, cesarean section. intrapartum care guideline along with CTG. Very important aspect of our exam. Then obviously after intrapartum, preterm labor, intrapartum, postnatal care, cesarean section, surgical site infection. These are going to be even induction of labor as well. These are going to be one after one. So if you just notice that almost the important bulk, almost 90 to 95% of the labor and delivery module is going to be covered by this. Okay, the labor portion and delivery, yes, then the other portions from the the green top guideline will come, the breach presentation will come, the medical disorders when they go into the labor, so how you will manage and this and that, and be extremely careful with antenatal care guideline as well. Okay, I forgot to write it here. Then antenatal care as well, and antenatal care has been revised last month in August, 25th of August. So please follow the recent antenatal care guideline because you guys are preparing for Jan exam. Okay. For January exam, you have to follow new guideline of the antenatal care. Okay. Beware of the keys from the available pool in the books and the questions scattered here and there. Be extremely careful in keys. Okay. So always follow new latest recommendation from NICE guideline and Green Top guideline as well. Okay. So in terms of this, diabetes, hypertension, infertility, urinary incontinence. Okay, if you can just notice 1, 2, 3, 4, four important major topics and major, the modules as well. Incontinence, urinary incontinence itself is a big module. Infertility is a module, separate module in our curriculum, right? Diabetes, hypertension is part of maternal medicine spectrum. So if you can notice that, this diabetes mellitus and hypertension, obviously. So if we are covering hypertension, so we will have almost all overview of hypertension from this NICE guideline. And then we have got one TOG article on eclampsia, preeclampsia, what we can follow, okay, for hypertension, with hypertension. So this way we can cover this one topic, important topic. So in terms of this diabetes mellitus guideline, we have got couple of TOG articles as well because we have to cover diabetes as a whole. So we need to cover, the important complication guideline, the TOG article, which is diabetic ketoacidosis. We have to cover insulin pump in pregnancy. Then we have to cover, the large for gestational age, okay, or the, the macrosomic baby in the GDM as well. And beware of diabetes mellitus guideline again, because the GDM guideline has been revised in July 2021. Okay, only GDM recommendation. There are very tiny differences, but yes, and those should be acknowledged and those should be remembered for January exam. Okay, so this is going to be my recommendation to all of you, that always try to download all these guidelines from the website yourself. So this way you are not going to miss any of the important part from the curriculum. Okay. Then in terms of TOG articles, like Dr. Hassan said earlier, that we have to do 3 to 5 years TOG articles, yeah, isn't it? So the TOG articles which are from the old sources, okay? So from the old sources, we have to cover some of the important TOG articles. Cystic fibrosis TOG, cystic fibrosis, okay? Cystic fibrosis is a very old TOG, I think 2010 TOG, but we don't have any other source than cystic fibrosis itself. So yes, we have to follow. Headache TOG is also very old, 2013 or 14, I believe. So yes, we have to follow that TOG. Headache in pregnancy, okay? Enhanced recovery pathway, nerve injuries, spinal cord injuries, skin eruptions, hyperprolactinemia, surrogacy, assessment of male infertility, okay? Although this has recently been revised, so some of the points we can cover from 2013 TOG article as well, but not necessarily, okay? So we can cut this. So we have to do the recent one, 2019 or 20, I think 2020 TOG article of male factor infertility. SLE, appendicitis in pregnancy, perforated uterus, abdominal incision sutures, myocardial infarction, cerclage, bariatric surgery, thyroid dysfunction, borderline ovarian tumors, polyhydramnios, asthma, liver disease, okay, liver masses. So this is very much important. If you can just see and just look at the topic, that almost all medical disorders are being covered by, the Green Top guidelines. 2 topics from the NICE guideline, and rest of all these topics are being covered by TOG article. Okay, so if you just notice, all these are medical disorders, isn't it? Spinal cord injury, skin eruptions in pregnancy, then SLE, appendicitis, myocardial infarction in pregnancy, incisions and sutures, polyhydramnios, asthma, liver masses in pregnancy. So almost all these important talk articles you have to cover. Okay, so what we are going to do is that obviously when we will do our sessions, okay, so we will try to divide all these topics amongst of all of our mentors. So obviously we will be giving you exclusive overview of one module. So we are going to cover all these talks, almost all these talks, and obviously the green top guidelines and nice guidelines as well, isn't it? Dr. Hassan, any input? Yes, GDM is important. Any question from here, guys, from the curriculum?
Can I ask one question? Anybody who can hear me?
Yes, dear, I can hear you.
I want to ask that how we going to know that which module we have to review, because it has been outlined everything, but we don't know how to start. So if everybody is starting their own module, then how we will be going through the sessions? Like it is our own choice to start any module of our
No,
own?
obviously not. Obviously not. You are, I think you have already been given the schedule, and obviously you have to follow that schedule. For example, if the module is starting from today till next module, you have to cover those topics. Okay. For example, our first session is early pregnancy, the benign gynecology modules. So obviously from benign gynecology, you will cover almost all modules till the next topic. Okay, next module. So we will write all these, the module topics in your study room if you are part of our course. So obviously you will understand, and you will come to know that what topics are going to be covered. And in fact, our team is already there, and our team and usually shares the mini schedule as well. So just be vigilant, be in the group, and just try to follow. Okay.
Okay, and after that module, which we covered, then in the next session, we are going to discuss the old
Yes, obviously.
module
It's
in
not.
vision
It's not
form
like
or
old
the new
module.
module.
It's not like old module. Okay, so
Oh,
sweetheart, if you
oh,
have your benign gynecology today, okay, and it is 15th, and after like 7 days or 6 days you have maternal medicine module, for example. So I mean, till that you will definitely cover this, and on this, if you get time in this, okay, so you will just try to review the topics, and then obviously in the from the sixth date to whichever date is the next module, so you will cover, you will revise those topics again. So this way you will have multiple revision, you will have live session. So obviously you will understand with the mentor as well, and then later on, if you don't attend the session, so obviously you will have opportunity to listen to the audios whenever you want to, and afterwards you will study on your own. You will do the practice in the study room in terms of questions and all. So obviously altogether I think this is going to be the good practice if you just try to look into this. So don't worry about it, and we will be guiding you time to time. Okay. Okay. Is it clear to you?
Shall I
Okay.
ask one
Okay.
question? Hello.
Yes. Yes. Sure. Sure.
Is there any separate Telegram group for January 22? Still no, I don't know.
Are you part of course, sweetheart?
January I paid now. Before I was
Okay.
in September. I mean July. I mean September, but I couldn't get the seat.
Okay.
Now
Okay. Fine.
I
So
paid for this January 22. Is there any separate Telegram group
the team will
or
contact
January
you. Okay.
22?
Don't worry. The team will contact you. Don't worry about it. Okay. For all these technical issues, don't have to worry. Just text on the official the page and official numbers of MedExam. So definitely they will facilitate you. Don't worry about
Okay.
it.
Okay. Thank
Okay.
you.
At the moment, I cannot share anything with you, sweetheart, because if you are, the MB race report, Everything is downloadable from Google. So if you just enter the MBRACE report, you will get that report. Okay. Because I don't even know your name. So I will be calling you iPhone only.
No,
Are
no,
you
no,
iPhone?
no, no, laptop only. I am Dr. Tenmalar.
No. There is a girl who is asking, the question, and her name is iPhone. Okay, anyway. So then after studying, obviously we have to practice. We have to practice questions. So we have got a couple of very good standardized books with us. But again, I will say that be extremely careful with the books keys, because recently many of the guidelines have been changed. Many of the guidelines have been replaced. And obviously we have, plenty of talk articles as well. Okay. Then obviously what we need to understand is that, yes, we have to follow, we have to practice questions. But yes, on the other hand, we have to be very vigilant with the keys, because we have to do the keys, we have to do the practice according to the reviewed and the new guideline. So yes, we have got a couple of the single best answer books. We have got the very good quality extended maths questions books. So idea is that when you study one topic, for example, today if we are studying PCOD, okay, polycystic ovarian syndrome, so what you have to do is that you have to go through all these books, because certainly all these books should be with you either in the soft copies or hard copies. Okay, so if they are with you, just try to give 1 hour or so and just try to find out the related questions from polycystic ovarian syndrome. So this is how you can just the cover one topic in a good way in one day. So if you just try to divide and try to utilize your time and the study effectively, so there is no chance that you can miss anything in this exam. Okay, so for the single best answers, we have got Andrew Sizer, we have got Brian McGowan, we have got Amanda Jones, we have got Seema Sharma, mastering book, Janish Gupta book, and succeeding SPA parts. Okay. Andrew Sizer book, very good. Brian Magowan, 2018 edition, very good. Amanda Jones, Seema Sharma, mastering. Amanda Jones and Seema Sharma. This is a very beautiful book. Very beautiful book. Very beautifully designed questions. But yes, this book is very old. So probably you may see some of the difference in the keys. So don't just carried away with the, the keys. Okay, don't just get carried away with the keys. You have to follow the new guidelines and blog articles for the keys. But yes, the Amanda Jones, I personally like Amanda Jones book very much because the questions are very beautiful. Okay, because in the end what we have to do is that if we follow the standardized book, obviously, so we will have a clear the concept by the end. Seema Sharma, although it's a good book, but again it's an old edition. So be extremely careful with the keys. Mastering is a very good book, though it is very difficult, but yes, it's a good book. Janish Gupta, again, an old edition. Succeeding, because we have got only one PDF book, which is roaming here and there, and some of the questions are misprinted in that. Okay, so don't follow the questions and the keys as well for the succeeding book. In the priority, I would say that it's better to do Andrew Sizer, Brian Magowan, Amanda Jones, Seema Sharma book first, and then this Tahir Mahmood. Personally, I like this book very much. Very beautifully designed questions. But again, it's an old edition, so be extremely careful with the keys. P. Sinha, good book for obstetrics and gynecology EMQs. We have got two separate books for obstetrics, and the one is for gynecology. So be extremely careful. Kalaiwani. Now this book has been just revised, I think last year, 2020. Now it is with Get Through name. Okay, Get Through single best answer. Very beautiful book. Almost designed on the new Green Top guideline and NICE guidelines as well, and especially the blog articles, and Get Through EMQ part as well. So EMQ, again, be extremely careful. Andrea Pilkington, good book, but very old. I think of 2010 something or 2012, very old book, but only you can practice, because in the end, what our motive is that we have to practice as many questions as possible. Rekha Butankal, my another favorite book. Succeeding EMQ part, Justin Punje, very good book, very good book. Okay, I personally like this book. This is a very latest book, 2020 edition. So start with the latest books. and then go to the old edition. This is latest book. Jasmine Kunje, Andrew Sizer is the latest book. Get Through, Single Best Answer is the latest book, plus EMQ part as well. You can say, okay, Tahir Mahmood, you can choose then, and you can go, one by one to all these books. But trust me, once this book you may find little tricky and little lengthy as well, because the questions are very lengthy, and obviously, the explanations are very, the good. But again, be careful with the keys, because some of the keys can be controversial, and you just have to go through your own studies and your own, the concept for the keys as well. Okay, so this is going to be the general advice for, the preparation for all of us, that how you have to do the preparation. Okay, so first thing first, and the foremost thing is organize yourself. Organize yourself in terms of that, whatever you are going to study, that make folders of all modules. Either you are an online person, okay, you can study from desktop, laptop, iPad, MacBook, or even you can get them printed as well. For me, myself, I am a little bit, the old school of thought, the person. I bought my old printer when I was studying for my own exam. So I do download, I do print the guidelines on daily basis. Okay. Whenever I want to, I do get it printed for myself, and then I study, because that is going to be handy for me, because some few pages I can take to the workplace, and while I'm traveling and here and there. So that is kind of, good for me as well. Then, yes, uh, then secondly, have a good grip on all salient points from guidelines and TOG articles. Emphasize on facts, figures, and percentages, like some of the incidences, recurrence, prevalence, and important, the figures as well. Post as many questions as possible from all available pool, and the available pool is this. Available pool is this, and be extremely careful with the, the copyrighted, the portion of the RCOG from the e-learning and PASM RCOG as well. Okay, because this way we can put ourselves into danger, and we can put our groups into danger as well. Okay, so be extremely careful, because these books are free, and yes, because these are for us, so we can practice all questions from all these books, but be extremely careful with the copyrighted content and material. Then this is important. Discussion helps. Discussion helps a lot. Okay, all the time what I see is that, key, key. Everybody is concerned with the key. Okay, why key? Why don't you answer yourself? Why don't you justify your answer? Why don't you ask? Why don't you discuss? Why don't you fight amongst yourself? Okay, key definitely is going to be there. Okay, with the after a few hours, or say, okay, after a few hours, or questions can be posted in the morning, or if you are posting, you can post one question, then you can come back after 2 to 3 hours, and then you can see how many, the people have answered in one thread. So this way you will learn that, okay, that out of, for example, 20 people, 19 have correctly answered. It means that, you guys are good. Okay, so yes, then you can post your key, and if any explanation is there, try to post there as well. So this way what you are going to learn is that you are going to learn the key with the answer, and when you are going through the explanation, you might, come across an important aspect of the question as well, for the topic as well. Okay, so this is going to be my suggestion to all of you, is that please discuss, because
Yes,
if you are
Dr.
in a
Zaib,
group. Yes, yes.
yeah, I'm very sorry for interruption, but
No,
I would like to say very important thing. Now,
Mhm.
you have to deal very cautiously with recalls, okay? Because most of candidates are so much running to answer recalls and the old recalls, and trying to memorize the recalls.
Yes.
Recalls are not well prepared questions. They are carrying too much defects in information in the build up of the question itself. So it carries many mistakes. So I don't never recommend start answering recalls unless you are very stable and standing on a very good base of knowledge. I think this is a very important thing, because if you are not very well based knowledge toward these questions, you will find yourself answering too much questions wrongly, and you may print wrong informations inside your mind. So dealing with the books, I mean the pool Dr. Zaib recommend for all of you, is ideal because these sources carrying a good reference, and all of these books are revised and updated. So when you are going to answer the recalls are made actually by some colleagues and some candidates who remembered few questions from the exam. These questions may be defected, lack of information, and so on. Options are very poor. So don't depend on recalls unless mentors direct you towards the true answer or how to answer this question, or you are very well establishing yourself in knowledge base. This is my advice.
Exactly, exactly. A very good advice, in fact. And Pradhanya, welcome, sweetheart. So if you want to throw any idea on this, that you know how to prepare, this is going to be good for all of us.
Hi, Dr. Zaib. Hi, Dr.
Hi,
Hassan.
hi,
Yes,
sweetheart.
Hi, my dear friend.
absolutely,
How are you?
absolutely agree with everything that you're all saying. You're my mentors as well. I've just followed whatever you all have told me. Every single
Exactly.
thing is 100% true.
Exactly. Because obviously, whatever we say, like I said earlier, that you know we are giving you from our experience. Okay, we are teaching you from our the thorough knowledge, thorough study as well. So obviously, try to take advantage of that. Okay, try to tag us, try to ask. Okay, and my dear all of you, that whenever in question there is no when, why. Okay, so this way we are not going to learn. Trust me, the ready-made things are okay, they are helpful for all of us. And yes, you should be facilitated, and you should have all ready-made pool, all ready-made summaries, videos and audios, whatever. But in the end what is going to matter is your concept. Okay, so if your concept is clear, if you think that you are well prepared, so what will happen that in exam doesn't matter if the question comes from south, east, or the west or north. But if your concept is clear, then 100% you can solve that question. Okay, so this is going to be my advice, that keep your concept clear, not the question and not the recall clear as well. Okay, so I will try to, and we all will try to give you the tips and tricks in all modules and in all questions, that where we do get confused in exam and where do we lose the exam as well. Okay, so if there is any confusion in the topic, always open sources and cross-check latest TOG article and the guidelines for reference. And always remember, for the question, we have our first priority green top guideline, then nice guideline. Okay, then comes TOG article, and then comes minor sources as well. Okay, so this is important. This is what I will emphasize more. That make your own small notebook, note down all important points from guideline or TOG articles you read. Okay, so this way what will happen is that by the end of your preparation you will be having one small notebook with you, and that is going to be a kind of the holy book for you. And you won't believe that till date I have my the part 2 preparatory notes with me. Okay, I have my two notebooks, small notebooks. When I was preparing for my part 2, those two small notebooks had to be with me all the time, because I was working full-time registrar in a very busy hospital. So what I used to do was, I used to carry those notebooks. Whenever I used to get time, I used to open those books and I just used to revise. Okay, doesn't matter one topic, two topic, or three topic, but yes, I am utilizing my work, I am utilizing my free time. Okay, so this really helps, trust me, this really helps. So make your own small notebook. Okay, and discuss with a study partner if possible. Otherwise, take part in discussion on group. And when I say discussion means, yes, ask your fellow colleague, ask your friend, ask your the person who is with you in the the course. Okay, for example, if you are studying with the course, or with so many fellow colleagues all around the globe, so what you can do is, you can post one question, and if somebody has answered any of the question, you can ask her, okay, dear XYZ, can you please tell me your explanation, why did you choose this? Can you please tell me why did you choose this? So this way you will discuss, and you won't believe, now you have 4 mentors to watch over you. You have 4 mentors to give you the the knowledge wherever you will get one.
Dr. Zaib,
Yes.
let me say something. On the MedExam Expert website, there is a summary for the curriculum under the name of Masterpiece. Okay, this Masterpiece book, actually, it is my own notes when I was studying for the exam. Okay, of course, it had been revised and once, twice to match the updates from my date of exam until now. But actually, the core of this book is my own notes, which I tried to build over many years while I'm studying for the exam, either part 2 or part 3. So this is why Dr. Zaib is advising all of you to build up and to start up to write your own notebooks for the exam. Because at 3 or 4 days before the real exam, you will only revise the whole curriculum from your own notes. And it's very important for the short memory and long memory revision. So I agree 100% with Dr. Zaib. You have to do your own notes. Don't depend on Hassan notes, on Zaib notes, or everything. Everyone, try to build up. And maybe one day you will be a mentor by these notebooks. Exactly.
Okay. Obviously, because everybody has different style, everybody has different, way to study. Like I said earlier, that everybody is unique in so many things. And it's not always that, if something is important for me, so probably that thing is already in your mind and your concept is clear for that. So yes, probably that thing is not that important for you, isn't it? So discuss, please. Okay, all of you, even if you take this message at home after this session, that you have to discuss, you have to throw light, you have to discuss, you have to ask your fellow colleagues, trust me, it's going to help you a lot. Okay, so in terms of exam, so try finishing your first reading in 3 or 4 months. Okay, roughly you can say 3 to 4 months, then revise them all. Okay, how doesn't matter how many times you can do, but till exam, obviously, you have to study, you have to revise. So if you just finish your the whole curriculum in like 3 to 4 months, and trust me, in a good way, along with your own the notebooks and all, so obviously it's going to give you a very good edge. Okay, that you are confident, you know what you have studied so far. Okay, you know what have you missed, and whatever you have missed, so obviously you cannot cover it in the end. So obviously if you have missed something, so yes, we are going to help you in that as well. So if you guys are stuck somewhere, so always ask us. And trust me, this is a kind of the good opportunity to all of you, that you will be having 4 mentors to bug, 4 mentors to the ask, 4 mentors to tag. So obviously we will try to help you whenever you are going to get stuck. Okay, so make your own notes. Then general strategy to prepare for part 2 exam, the most and foremost, and even the last but not the least advice is going to be positive. Be positive towards what you have learned, so far, and try to absorb it with your examples, references, and reasoning as well. Like I said earlier, whenever in study, if there is no when, why, what, okay, you are not going to learn. Okay, always think that if this is the key, then why this is the key? What is the reference? Okay, then what is going to be the answer? Okay, so this is extremely important in our curriculum, that at least we should understand and we should need to justify our answer as well. Okay, so be positive, because you still have got time. January is like, almost 5 months are there. So what you can do is utilize this time wisely, try to cover, try to be serious in your study as well. Okay, and this is where we all would step in and help you practically with all the curriculum and preparation method described before. Okay, so obviously we are going to help you with the live sessions, we are going to help you with our summaries as well, and obviously the physical support in the study room as well. Okay, so like I said, you guys have 4 mentors, so obviously you are going to have the plenty of the knowledge, plenty of experience, plenty of the guidance as well. So try to utilize all these 4 mentors effectively. So if one is not there, you can ask the other one, and just be careful that we all are working as well. So obviously we are going to be with you, but there can be some kind of the lacking in the answer or even delay in the answer as well. because we all are working as well. Okay, but certainly by the end of the day we will be with you. By the end of the preparation we will be with you. And yes, so this is going to be our course, okay, in which we are going to give you, okay, the live session. And this is a major highlight, okay, because in the live session you are going to interact with all of us, okay. We will be kind of one-to-one, okay. So we will be dealing, and we are going to talk to some each another. We are going to ask questions, discuss, and discuss many things, okay, apart from even modules as well, because this is our habit that once we start our session we always ask, how was your week, how was your day, is everything okay with you, are you guys preparing well, the general talk. So if somebody is facing any kind of difficulty, then yes, if you guys are comfortable, you can always come to our inbox as well and share your problem, share your thoughts as well. So probably we can guide you in a better way, okay, because we all of us want all of you to be in good position to absorb all this knowledge and the material as well. So in the end you come out as a successful candidate in exam. Okay, so if you miss any live session, you will be getting recording very next day once it is processed, and obviously it's going to be on your website, on your account, and topic test of each module is also going to be there. Then there are going to be the green top guideline and nice summaries and talk summaries as well. Okay, and yes, this is a very the good effort of med exam expert that they are providing you with all these summaries, because the team and the mentors are working on them every day. But my advice is going to be, don't completely rely on them. Okay, this is just for help. This is just for help. All you have to do is first study yourself, and then yes, okay, if you are stuck somewhere and if you want to revise, or if you want to see that if you haven't missed anything, okay, go back to your the website and your account and just follow these summaries. This is going to be enough. Okay, but yes, first try to study yourself. If you cannot study, if there are multiple problems, then yes, these summaries are going to be helpful for you. Everything is for you. Okay, it's going to be there with you. Okay, summaries in videos or audios, whatever, but those are going to be summaries. Okay, don't worry about it. And the major important thing is exams, mock exams. This is where you are going to judge yourself in your preparation after like every module. Okay, then you will have GTG and nice question bank separate, single best answers and EMQs. Okay, you can practice as many questions as possible, talk question bank as well. And this is going to be a study room where we are going to help you. Where we are going to interact most of the time after one live session. And obviously there is going to be mentorship for the course as well. We all are going to be with you until you finish your exam, until you become MRCOG. Okay, so obviously you will have topic tests are going to be on your website, obviously. Okay, once you finish your one module, so you can go and you can practice your modules, and team will guide you for all the technical support. And by the end of my talk, I will hand over to one of my team member, so she will guide you that how to use website and how to go about. Okay, don't worry everyone. So definitely we all be there with you to guide you and everything. So just be there, try to ask. Okay, then
excuse me, ma'am.
Excuse
me.
Yes, yes.
Yeah, I wanted to ask from where we can get those books for SBAs and EMQs like Andrew Sizer and all those books that you mentioned previously. Like from where we have to get those? We have to.
You can buy them, or there are multiple groups in which they are freely available, so you can download from them. Okay, don't worry.
Okay, thank you so much.
Okay, great. All right. So Asma, are you there?
Yes, Dr. Zaib.
Okay, sweetheart. So over to you. So now you can give the overview of the course and how the candidates can contact you guys and can seek help. So please guide them.
So thank you so much, Dr. Zaib and Dr. Mohamed Hassan, for this amazing session. So I hope all the students are clear about this. So if you want to join this amazing journey, you can join this course. And our course is starting from 15th of September. This was our first introduction session. So if you want to enroll in a course, what you have to do, you have to create your account on our website. After that, you have to sign up, okay? After signing up, you have to click on the course, Plan C, MRCOG-2 and then you have to proceed with your payment.
Yes, like Asma said that, we are going to be 4 mentors, Dr. Mohamed Hassan and me, myself, Dr. Pooja Sharma, Dr. Pradnya, and today is our first orientation session. And then obviously, we will be with you till January 2022 exam. Okay, so this is what I want to tell you, that do not worry about your duty rosters. Whatever you will miss, okay, you will get in the form of recording. So be hold to the schedule and join live sessions according to your schedule by setting your own duty rosters as well. This is an advice, and if it is applicable, you can do that. If it is not, then doesn't matter. Okay. So as a med exam expert team, we are helping you sail through this tough and long journey. So we will be, the hand in your preparation, in your, this long journey as well to just become MRCOG. Okay. So this is going to be a collective effort from all of us to all of you, that we can, guide you in a good and a collective way, that at least you guys will be, in a good shape to go for the exam. Okay. So this is about our, the course schedule. So obviously, our first session is today. Then second session is going to be with me on 20th Monday. The time is going to be same. Then fertility session, Dr. Hassan will take. Early pregnancy problem, gynecology 1, oncology. The 2 sessions are going to be covered by me again. Postpartum problems will be covered by Dr. Pradnya. Urogynecology, the maestro of urogynecology, Dr. Hassan will cover. And then management of labor and delivery, I will cover. Antenatal care, Dr. Pooja. Obstetrical emergencies, Dr. Me, myself. Then sexual and reproductive health, Dr. Pradnya. Post-operative care, Dr. Hassan. Contraception, Dr. Pooja. Core surgical skills, Dr. Hassan. Teaching and clinical governance topics will be covered by Dr. Pooja. Infections and sepsis, Dr. Hassan. And maternal medicine, I will cover in almost 4 sessions. Okay. So altogether, we will be having a very, a kind of a good journey, and yes, a kind of the journey in which you will face, the plenty of, the good topics, and obviously we will try to cover all these modules in nice way. And in the end, the last 2 to 3 sessions are going to be on the important exam question revision, and also an exclusive biostatistics workshop. Okay, so biostatistics workshop is going to be the part of your course where you can learn important aspect of exam biostatistics questions with our expert mentors. Okay, because for me myself, I'm so poor in biostatistics, and I cannot even, solve a single question of biostatistics. So whatever I have learned from the this only the med exam workshop. So over to you, Asma. Now you can guide, please.
If you join us in this amazing journey, what you have to do, you have to click on the website link or mid-exam expert link, and then you have to create your account by simply signing up. So you have to enter your details in that. After that, you have to log into your account. After that, you have to select the course Plan C, MRCOG-2. In this, you will be enrolled in the course. So then after that, you have to proceed with the normal payment link. And in this way, you'll be enrolled in the course. And after 1 hour, you will got the access of all the modules of our course.
And I want to add over here is that, you can have your friends with you. You can join as and get an group discount as well. You can have installment plans as well. So we are here to help you in all possible ways, whichever you want to do. Okay. So yes, if it is easy, if you think that you can go along with this, the schedule, and you are happy with all this, the distribution and all, you are, kind of more than welcome to join us. Okay. So you can always, contact our technical support team, and this is our official WhatsApp number, med exam, the email address as well. And obviously, all of us are reachable, easily reachable on all social media platforms. So yes, you can even, catch all of us even on Facebook, Telegram, and wherever you want to. Okay. So is everything clear to all of you, that how we are going to utilize our sources and our time for this course? Is there any question? Please ask. Feel free to ask. Okay, sweetheart, Sadia, very good. So don't worry, okay? If you have any question, you are more than welcome to contact any of us, okay? So we are working as a team. So obviously one or the other, the team member will definitely going to tell you. I have told you about this, the topic test as well. Topic test is going to be on your account, obviously. Okay. So if you are with your, the valid email ID, so obviously you will be in MedExam Expert, the website, and the topic tests are going to be with you. Okay, and you can solve them as many times as possible, and we are going to announce the topic test winner as well. Okay, so it is very much important that at least you guys do this topic test before the next module test. So obviously this is going to give a good feeling to all of us that how many candidates are getting scores, and the people who are here from my part 1 course, so they know my habit that we used to do this thing, that we used to announce this as well, that okay, this in this module this candidate has scored the high, and this candidate has scored this much. Okay, so now you have to score. Okay, for the topic test, again I want to say that probably the pass markers are going to be little high. Okay, little high. So it's better if you can do, or whenever you are ready you can do. Okay, but it's highly recommended that you attempt the topic test or the module test before next module. Okay, before next module, so at least it will be easy for us to compile the result, and it will be easy for us to publish that result in study room as well. Okay, so I hope it's going to give a good feeling as well, and a competitive environment too, that okay, this time, okay, for example, Aswati has got the highest marks, and probably in next session Komal will get the highest marks, and in next topic maybe Sadia, or next topic maybe the Samra, or whoever the candidate is. Okay, so yes, this is going to give a very good feeling and a positive and competitive environment. Okay, so I hope it's going to be a good journey. So I wish you all the best, and I wish you all the luck as well, and courage too, because this exam is the curriculum is like ocean. So obviously we have to sail through this exam, and we have to do the the collective effort to pass this exam. And we will try to be with you, and we will try to give you a hand in your preparation as well. Okay, so if you guys have any questions so far, please ask. Thank you so much, Iman. Thank you so much, Sadia, Aditi. So I hope it's going to be a good journey. So I am looking forward to it and excited too. So I hope you guys will also be, and together we will, and together we can, and together we will. Okay, so always remember this. Dr. Hassan, any goodbye or any conclusive notes? Dr. Pradnya?
Dr. Zaib, yeah,
Yes.
Dr. Zaib, thank you so much for this magnificent session, very, very informative session, and very important information to all candidates. Thank you so much, everyone attending this session. We took your time, but I think all of you understanding very well the principles of the course, how to study for the exam, the preparation for the exam, and what is the plan. So all together, we can move towards success, and
Yes.
we are believe in success. This is the point. Thank you so
Yes.
much, everybody, and
Thank
see
you
you
so much,
very soon in
everybody.
our course. Thank you.
See you next week on 20th. Okay, so I'm going to take first session. So hopefully that's going to be a good session. I will also post all topics in your study room right after this session. So just be there, just try to revise whatever you can. And I think you guys have already revised your gynecology module. But again, I will write down all topics. So what we are going to discuss. So together, I think this way we are going to have a very good session. Okay. Thank you so much, Shahira. Thank you so much, Seema. See you all on Monday. Okay. Take good care of yourself and your loved ones.